Hey there, folks. Welcome to the show. Hey, before we even get started, if you would, please click like or subscribe if you're watching this on the YouTube channel. And if you're listening to it on Apple, Spotify, or wherever you get your podcasts, please leave us a 5-star rating. I would greatly appreciate it. And also, today's episode is brought to you by Authentic Health. These are the makers of high-end, high-quality, physician-formulated nutraceuticals. You can check them out at shopauthentichealth.com. And if you use promo code Jason, you're going to get a discount off of your order. So today's guest is Niklas Anzinger, founder of Infinita City, a bold experiment at the frontier of biotech governance and community building. Infinita City is reimagining how innovation hubs can look and function, creating a place where entrepreneurs, scientists, and investors work side by side to accelerate breakthroughs in human health and longevity. Niklas has a fascinating background in venture building, charter cities, and fostering ecosystems where ambitious ideas can scale. In this conversation, we'll dive into his vision for Infinita City, why the future of bioinnovation depends on new models of governance and collaboration, and what it means for all of us who care about health, freedom, and the future of human flourishing. Thank you so much for listening. All right. Niklas Anzinger. Does that sound, is that good, Jerk?
Very good. Very
Right.
German,
Very
yes.
good. Folks, I have got one of the most fascinating guests I've had in a long time. Of course, I like to think all of my guests are pretty fascinating, but the reason why this one is really, I'm excited about this conversation, Nick, is because this is stuff that I love geeking out on. This is something that I've not only made kind of the closest thing I have to a hobby, which is health, wellness, and kind of exploring the new frontiers of medicine 2.0 and the human system and what it can do for longevity and for health span, but also try to bring some of these things into my vocation, bring it to people that don't understand a lot of the agency that we have in our own bodies and the way we can take care of ourselves. And man, you are at the forefront of some of the coolest stuff that I have researched in a while. And so with that tee up, let's just get started with this. Who are you? And I want to say that you've kind of created what might be the mecca of biohacking, or kind of like that cutting edge human research. But how did your journey to all of what you're working on now? Where did this start?
Yeah. I mean, first of all, fantastic to be here, Jason, and thanks for that really kind intro that I don't think I deserve in full, right? Because we're just getting started. And, you and many of your previous guests have already achieved a lot. I think we're setting out to do something extremely ambitious in ways that haven't been doing before, but we're really just getting started. But how did we get on that path, right? So I was like many others, an entrepreneur looking for what's my mission in life, what are the biggest possible problems to solve. I looked into healthcare and I realized something, right? I realized that the most thing we can do really is build band-aid solutions, right? Because the fundamental problems, what they result from, is kind of a failure on regulation and legislation, right? So much of what we call like the sick care system or like the drug lag, often it takes like decades before like the latest science is actually making it into the market, into the clinic, into patients. Right. So Ozempic and GLP-1 drugs are a perfect example. The first trials were done in the 1980s. So what makes all of this take so long? Like the science and technology is there. It's really sort of the regulatory and governance layer that is the problem. And I was always interested in these questions. I studied philosophy and economics. I got into free markets. I got into seasteading. But all of that struck me as something utopian, right? I was an entrepreneur. I was working in startups. I wanted to do something practical and something real and not like theorize or argue. But then 3 years ago, something changed, right? So I became a digital nomad. I came to like travel different places around the world, and I stumbled upon the project of Prospera, which is building a special economic zone on a Caribbean island called Roatan in the country of Honduras. And they had an unprecedented degree of legal autonomy that really allows for a different approach to regulation to get things right, that I think is ultimately an upgrade to much of the American project, which got a lot of the foundations of like liberal democracy right, but sort of missed some things that I think is Prospera is aiming to correct. And I think they have the right theory about it. And that made me want to, like this, I said, if this succeeds, then we're going to change history. Like if we can give an upgrade to the legal and governance system, an industry that hasn't been updated in like hundreds of years, and we can prove we can solve some of the biggest problems in the world, like longevity and aging, through healthcare and things like that, sort of according to what was finding before, okay, regulations are the problem, we need to do it differently, then this is going to be the biggest possible impact I can possibly create an entrepreneur. And since then, I've become obsessed with that question, how to build sort of a modern, great biotech jurisdiction that allows entrepreneurs and scientists to go to market 5 to 10 times faster than they can right now.
Which I think is so exciting, and so I wanna get into and a lot of the people that are gonna listen to this, Nick, they'll be like, "Okay, I don't understand, like, the FDA. I know what the FDA is," and they're just the only drugs that they know are those that have actually passed FDA approval. They don't understand the clinical trial process, and one of the things I think that unless you're faced with it in real life, a lot of people don't understand what it means to suffer an illness. Let's say that you get that horrible diagnosis, you have cancer, and there's a therapeutic out there that a physician has said, we have seen the data, this works, and in this particular case could be very advantageous to the patient. And the patient says, I'm willing, you can try it, it's my body, it's my health, I want to try this. But then there's this problem, the FDA has not approved it, and so therefore that doctor is just kind of sitting out there alone facing a huge malpractice lawsuit if something goes wrong. So kind of unpack for the audience just some of the things that you've seen when it comes to these potential therapeutics, not just for healing acute and disease illnesses, that sort of thing, but also for longevity. I mean, rapamycin is probably a bad example, although I don't even know what the FDA status is with rapamycin, but some of the other things, the use of metformin and other things for longevity, we see these things that we could be doing, and I just pull those out of my hat. I don't know where they are in the FDA process, but things like that for use. You mentioned GLP-1s and how they went through the process for so long, and even though we knew they had the benefits for diabetics, we knew that they could actually they could help with weight loss. It took forever before they could actually be prescribed as a weight loss drug because of the FDA and all these different clinical trials. So kind of help the audience just understand, like, and if you have an example, maybe taking through and also picking up on kind of what you and Dylan did in Montana and getting and why that was so important. Just kind of help this audience understand kind of the environment that the FDA creates.
Yeah. So let me say two things, right? So, because one thing that's important to understand is that longevity and preventative medicine really breaks the paradigm of the FDA, right? Sort of it goes against some of the assumptions behind it. But let me also first say, like, what is the FDA? Most people trust the FDA. It's the most powerful public agency in the world. It regulates 20% of US consumer products, right? By extension, also much of the rest of the world, because the United States is the largest market for biopharma in the world, right? So it's an enormously powerful agency, and its mission is to ensure that we get safe and effective drugs, which is great. This is a good mission. We want safe and effective drugs. The question is it the right structure to get safe and effective drugs? And there's a couple of problems with the mechanism how we get there, not with the goal. The goal is correct, right? And the problem with that is, if you assume that regulation is a good thing, which I do assume, right? So having oversight, having transparency, having information, these are all good things. But at what cost, and how do you deliver that, right? So the FDA has a monopoly over providing regulation or over overseeing safe and effective drugs, and monopolies have no competition, which means over time they get worse in their service and their quality, and their costs are increasing and the timelines are increasing. And this is what you see with the FDA, right? So, it has a mandate for something that is valuable, getting good information about drugs. But the problem is it has no competition, right? So if they do something, mm, if they fail to allow a bad drug, there's no consequences for them. They have no upside from that. But if they happen to allow a bad drug to the market, then they face the consequences from Congress and from the voting public. So their incentive is to be hyper conservative. In a better, sort of more market based system, you'd have competitors, you'd have more of a certificatory system. You'd say, hey, here's like a very fast track certificatory agency, right? So it has some preliminary testing, but it's kind of at your own risk. Like you're required to have like the correct labeling for it and things like that. And then the FDA is like some gold standard. So this is one thing, right? So one thing is generally rethinking how the FDA works, but fundamentally many of these things they do, like testing for safety and efficacy, are good things. But then what's a very big problem is, and that's not necessarily the FDA's doing, it has much to do with our assumptions about science, um, that longevity, preventative medicine is a fundamental mismatch with the current pharmaceutical and healthcare system, right? So that is more designed to treat what's called clinical endpoints. So when you're sick, then you get medicine, right? So we're treating you when something is wrong with you. There's nothing fundamentally wrong with this approach. It's just not the only approach, right? So many diseases you could like prevent if you start earlier, right? So we all know that earlier exercise, diet, and nutrition is really sort of helping prevent some other diseases. And there's also potentially drugs and treatments and medications that could, in an earlier stage of your life, treat what in longevity we call the root causes of aging, or cause aging, sort of treat aging itself. And the theory is that aging is then causing other diseases. But you can't get drugs approved for that, right? Because new drugs or treatments need to be approved for the efficacy and safety for what's called a clinical endpoint. Like, are they treating cancer? Are they treating ALS or whatever? Right. So if you say, okay, I have this thing and it treats like multiple of these things, right? By preventing them, that just doesn't work. It doesn't fit into the current paradigm. And this makes it so important, really, to um, have an alternative, right? This is raising the urgency, especially for the longevity industry, which has made a lot of progress in the science and technology it has in the last 15, 20 years, but really needs a way to succeed and needs a way to show what's possible and bring new drugs and treatments to the market.
So, and the exciting part about this is what you said earlier, and this is what I'm fascinated with, and this is where a lot of my work is taking me is into this idea that our healthcare system in the United States specifically is so much based on sick care versus healthcare. And so, to your point, this whole idea of using these therapeutics as part of the aging process, which we for so long, up until the last, I'd say maybe 5 to 10 years. I think 10 years is kind of a stretch, but especially in the last 5 years, we've really accelerated with our thinking that disease can be, or excuse me, aging can be treated as a disease. I know that became popular with Sinclair's work and what he did, and then I know there's controversy surrounding that. That's not the point. To me, just from an idea standpoint, what David Sinclair did bring to a lot of the conversation as it relates to medicine is what if we started tackling aging as in and of as its own form of a disease or illness, as opposed to just yes, chronologically we can't stop it. However, a lot of the cancers and stuff that show up are, we could prevent them, but and which became novel for the idea to start, okay, why would you take a therapeutic unless you're actually sick? And then it becomes probably a scarcity issue, and the people that actually need it aren't going to get it because you're giving it to, you start getting metformin to healthy people who just want to stay healthy, and there all that controversy surrounds it. So but now I think we're to the point, and this is one of the things I think I mentioned to you when we first spoke, and I had this conversation with a lot of folks lately, is that it doesn't matter what you think of Robert F. Kennedy Jr. and what's going on at Health and Human Services. You cannot deny the fact we're having conversations at the national level that we just haven't had, and not in my lifetime. I mean, the stuff that you and I are really interested in and trying to do, that used to be a pretty niche deal. We listened to the Ben Greenfields, and maybe you kind of your gateway was Tim Ferriss talking about something crazy like cold plunge back in the day, and now then all of a sudden you start hearing from Matt Caberline and Mark Hyman and all these other brilliant minds saying, no, this is real. It's not just kind of quack science and a bunch of woo-woo stuff. You can do these things. And now we're really taking it to the next level. And that's what excites me is that guys like you are not only bringing to the attention to a more a greater audience that, hey, you don't have to wait for that diagnosis to start treating the symptoms that could lead to the bad diagnosis. And so that's really exciting stuff. Now, one of the things that I want to go back to, because I love you said something about bioregulatory jurisdiction. Did I say that right?
Exactly,
I
right?
love the term.
So, yeah,
I get it, but explain to the audience why it's so important to have a jurisdiction where you can have a little more liberty and freedom to do some of these things.
exactly. So when, you live in a place where you can't do the things you want to do, like, the America back in the days and the immigrants from Europe in terms of like practicing their religion or like experiencing authoritarianism or just fundamentally wanting a different way of life or community, you leave and go somewhere else. Right? So that happened all throughout history. And unfortunate to many people in the United States, which is the epicenter of innovation in biotech for decades, people are leaving the United States, like for medical tourism abroad to Mexico, to Turkey, to Thailand, to Malaysia, for clinical trials abroad. Right. So companies are doing clinical trials now in Mexico and Colombia, some of them here in Honduras with us, or in Australia, which has become kind of a clinical trial haven. Right. So companies that face too many burdens are going to other places to be able to succeed. Now, in Honduras, in Roatan, with a special economic zone, we want to create an alternative, the ability for companies to do clinical trials much cheaper and faster, and for patients to get treatments. Like it's a very attractive destination. It's a cruise ship destination, things like that. But we're not confined to that, right? So the idea is not that we're like some offshore clinic and do things there. We actually want to create a broader path to legitimacy, like to legitimizing and to mainstreaming some of these ideas that underpin some of what we do here in terms of the regulatory structures. For example, that insurance has a bigger role to play in assessing risk, right? It can sort of underwrite some of the risk that you're taking, and you have informed consent and medical autonomy and things like that. And this is kind of also where the Montana program comes in. So some of these ideas influenced our conversations and the right to try legislation we have there, right? So there is a path how the rules can be changed and how sort of as a company we can have some influence on that and build sort of advantages for other companies around sort of a better regulations.
So that brings me to the thing I'm most interested in, which blows my mind. Um, and I'm going to make sure I pronounce it right. Infinita. I mean, it's a take on Infinity, Infinita City, which is kind of this jurisdiction or kind of this haven that you have created, which is absolutely fascinating. So, first of all, I want you to just give us like a high level view of, because I plan to go there next month. God willing, if we can make that work. Um, Tell me what happens, what people see, and who are the people that are coming there, both from the the clinical standpoint, the researchers and some clinicians to study and to figure out new therapeutics and things that we could do, we could explore, as well as potential, I guess, patients, clients, whatever you want to call them. Give us kind of a flavor of what's going on at Infinite City.
Yeah. Sure. So Infinita City, we're building. Right now, we have a hub or a district within Prospera, right? So Prospera is the project that builds like a startup city in Roatan in Honduras, right? And we built the biotech district here, right? So what we do, we've brought several thousands of people to come here to help us build it, to experience and contribute to some of what we're doing, right? So there is some biotech companies here. The most famous ones are called Minicircle for the certain gene therapy and Unlimited Bio, VEGF gene therapy. They work with a local clinic here called the GARM Clinic, which is American doctors that went to Roatan to provide people with stem cell treatments. Um, so we have a small ecosystem here. We often do startups and pitch competitions for new biotech and healthcare companies to use some of the jurisdiction of Prospera and sort of are aligned with us on this mission to make death optional and longevity, right? So we have a little startup hub here, basically, in Prosper and Roatan. We have some medical infrastructure, not that much yet. Like it's not that you can do like research, blood testing are still a bit difficult, and importing things, but we're starting somewhere, right? And there's also a drop dead gorgeous location. Like Roatan is a tropical paradise. And what you will experience is that you meet some of the some really, really smart people here, right? So we had Brian Johnson here, Aubrey de Grey on the longevity side, We had Balaji Srinivasan or Naval Ravikant or Jim Draper, the famous venture capitalist who invested in a bunch of companies here. Like we collectively raised about 20 million for our companies here. So it's kind of a startup hub here. And it's the beginning of something bigger we want to build, which is a biotech jurisdiction that has multiple hubs, right? So Prosper Rotan is our first hub. In Montana, hopefully we can build a second hub through right to life legislation. And then the goal is that we build different hubs with medical and clinical infrastructure based on enabling legislation in different places around the world. It might include like Dubai in the future or Singapore or other jurisdictions that are open to bring that kind of innovation into their
I was
countries.
gonna say, I was gonna ask you about Singapore because it sounds to me a lot of like what you guys are doing and just kind of the environment, the government environment there. It's very reminiscent of Singapore back in the day, which a lot of people don't know. They just assume Singapore has been around for that has this ancient history, but it's not. It's very much like what you guys did. There was a purpose there for developing a commerce area that was safe, clean, friendly regulatory environment, and it's one of the most prosperous areas on the globe. And it sounds to me like that's what you guys are trying to do, centered around the biotech. Am I kind of getting that right?
Exactly. So Singapore or Hong Kong or Shenzhen, China or Dubai are kind of the role models in our industry. Like these were all places that were very poor. Like Singapore had a per capita GDP of like 500 in the 60s, like a dirt poor country. And they succeeded. And why did they succeed? Much of the analysis comes down to a law and order and institutions. And especially like things like the common law. British common law is a very business friendly way of doing things and local autonomy. So the ability to do things differently on a small scale. Like very few people know that China introduced capitalism through special economic zones. They were seeing Singapore and Hong Kong as, hey, how can we have more of that? So, okay, give this small place, Shenzhen, which was like a fishing village of 30,000 people, give them some legal autonomy. And now it's like a modern manufacturing cyberpunk hub, right? So this is the recipe for success to catalyze economic prosperity and development. This is the recipe that Prosper follows in Honduras and that we're building on top of right? So our ideas kind of go a bit beyond the economic development and jumping right to the frontier. So we're realizing that some of the most frontier technology in biotech and in healthcare is just not seeing the light of the day, right? Because there is no place in the world where the regulations are rational and good enough to allow us to progress more fast.
One of the things that I'm hoping that we can do, I was mentioning this to someone else. So, we just opened our first through our nonprofit that I run as I'm on the board of a holding company, and then we've stood up both a foundation as well as a C3 nonprofit, and we're opening these access to health centers around starting in the Rio Grande Valley of Texas, and then we want to expand it, of course, nationally. And one of the things that I've challenged our team with is that I want to be able to take a lot of the things that you and I are talking about and bring it to those folks that have never in their life thought about sitting in front of a red light, that have never, stem cell work or anything like that because they're getting up, they're living their lives. For them, they're trying to figure out a way to survive, and if they and pushing off their health until they have to end up in an emergency room, which is tragic, and we see it all the time. And so I want to get some of these ideas that we're talking about into the more mainstream of the everyday person that will start to think about things like their VO2 max. That will start to think about mitochondria health and start to think about cellular health. And I think this goes a long way to doing some of that. Do you think, and just based on your research, that in America, we're getting a little more open to some of the longevity and like healthcare versus sick care mindset, or do you still see a strong resistance, in particular from like the physician community, which is great, which I guarantee you've seen this. The physician community, God bless them, and thank God for the wonderful physicians we have in this country, but they're very ignorant to a lot of these advanced therapeutics. Do you see that tide changing a little bit? Are you pretty optimistic?
I'm not sure I know enough to say. Like I'm German by background. I'm American at heart, and my wife is American. So I can only speak to what I observe, not necessarily from first-hand experience with clinicals or practitioners in the United States, right? So I do think kind of both is true that there is definitely an increased realization that there's better ways to do things. There's demand, right? So there is people hear about these things that you're talking about from Tim Ferriss, Peter Attia, and Joe Rogan, and they're curious. They want to try things, right? So not all of them are work or are legitimate, but I think there's a totally legitimate demand or need to iterate and to experiment. I'm not sure to what degree that's driven by practitioners or physicians, but I do think it is driven by people and by demand and what they want, right? And practitioners and physicians have to adapt to that.
So, just so that I understand, so this audience understands, and because I know that, obviously, I want to promote what you're doing to get as many people that are involved to either just inquire to learn more, but also support. Kind of give me the business model for Infinita City and everything that's going on there. Like, what is the business model? How are you ultimately? Not only are you going to make money there, but also bring some of this frontier medicine or therapeutics to the United States. What does that look like?
Yeah, yeah. So ultimately, we have three layers of our business. One is residents or members, then companies that we support, and third, we have our own currency, right? So we just recently have stablecoin legislation passed, and stablecoins have already surpassed Visa and Mastercards, and we kind of have a community stablecoin, right? Residents, right? So these are people that are supporting us in our mission right now, are contributing, are building stuff here. In the future, we can issue health passes to patients that get subscription access to our ecosystem. And then companies, this is our main focus, right? So we work with companies. Our goal is to have three phases, right? Ultimately, we help them to become a big pharma company faster than they otherwise could, right? So they start in phase one where they're a startup, right? So they work with us in Prospera, which has sort of a more innovative sandbox environment, right? So we help them get funding. In phase two, we hopefully can bring them to the United States, right? So Montana's enabling legislation would make it kind of a perfect place to be within a regulated market, do treat patients, collect clinical data much more cheaply and faster than they could otherwise in the United States, but in full compliance within sort of the largest market in the world. And then in phase three, get them to FDA approval, get them to approval in other jurisdictions, and help them become a big international company.
Now, will you be participating in that, or will there be like an equity opportunity for you guys in some of these companies that you're helping to stand up?
Exactly. So we collect equity in some of the companies. In phase one, it's a certain amount. In phase two, that's going to be a certain amount. And we also, in phase two and three, we want to provide them with regulatory insurance, right? So much of what we see as our role is to de-risk for companies to kind of take an alternative path, right? So it's very complex. There's lots of state and federal interaction. We're the compliance provider for companies, and we provide them with insurance, right? So we have the incentive to do it right for them.
And okay, and I'm very ignorant to digital currency. I don't own any crypto or anything, but I'm just trying to put the pieces together as it relates to your business model. So if I'm an early stage investor and I have I guess call it a coin or whatever for your currency, does that entitle me to equity ownership or privileges in some of these companies that will come out of this ecosystem?
Yeah. Potentially, we started a bit smaller and more iteratively, but it could go there as well, or it might go there as well, right? So right now, it's simply a stable coin, right? So it's pegged to the US dollar, or we just say it's a stable coin backed payment token, right? So it's similar to closed loop systems or like airline miles where you get loyalty
Got it.
rewards, right? So we didn't make it too complex for people. It's just you can treat it as like a dollar. And then when you use the currency, you get we get points, right? And these points right now you can use as cashback. So right now it's a simple cashback mechanism, like to reward interacting with Infinita City, with the ecosystem here and contribute to it. But we're thinking of ways in which those loyalty points also give you upside in the business, right? Because you're contributing to the economy that we create, right? There's different regulatory categories, so we're kind of slowly iterating. We've seen very good adoption of the token. Like, I'm also for background in Roatan here in Honduras. Like there is the Lampira, there's the US dollar, there's a lot of cash. And actually having like a crypto native ecosystem is actually making things a lot easier for people. So not every listener might be just aware of that. So especially when you're not like transacting internationally a lot, when you have your USD bank account, of course, that's easy. And learning something new, there's not that much difference it makes for you. But when you're transacting internationally, that makes a huge difference, right? So the first early adopters of crypto and of stable coins are people in countries that have unstable currencies, right? That is sort of and can send money and value across borders without transaction fees, right? So that's kind of what it does for us. It makes it really easy for people in our ecosystem in Roatan to transact with each other. And we almost like by issuing the currency, we kind of have a dashboard or a pulse on the economy, right? So we can bring kind of new vendors that provide medical treatments or give real estate or rent into the ecosystem by then accepting the token, right? Then we bring them users, right? So this way we have a pulse of the city as a whole.
Okay, and so that the stability comes from, and you're educating me here, just FYI, because I know nothing about this. So what's happening is instead of being, it's pegged to the US dollar. So essentially, once you have your coin, there's a stabilization. You're not so I guess they're not so beholden to foreign monetary policy elsewhere, regardless of where they come from in the world. They buy into the currency, and then it's stable within the ecosystem. So essentially, it's kind of like what the EU did years ago by getting everybody kind of coming together and kind of stabilizing cross-border currencies. It's all within the ecosystem, so that you're not the constant fluctuations and inflations and devaluations. It all kind of maintains the same buying power within the ecosystem, regardless of, for the most part, outside forces, regardless of where they're coming from whatever corner of the world they're coming into the ecosystem. Am I kind of getting that right?
Yeah, I mean, that there's not a strong like macro effect that's like right now it's simply for all intents and purposes, if you're a user here, you can treat it like a
Got
US
it.
dollar, right? It just makes it easier for you to
Got it.
transact here,
Yeah.
right? Right. So because you don't have to, because you're in Honduras, right? And the vendors here are used to it, and you get some rewards and cash back for it, right? So from a user perspective, that all you need to know. Also, the fact that it's backed by stablecoin basically is a commitment, right? So it's basically like a bank. We have just our reserves backed up one to one instead of fractionally reserved. It's what a stablecoin basically
Got it.
is.
Okay. Thank you for that, and I'm sorry for the listener having to listen to that tutorial on stablecoin for your host here, but I needed to understand what was going on there. All right. So now tell me this: Is there? I know there's a residence component to this. Is it a long term residency, or are these all going to be people that are just going to come for short term? Maybe in either their part. I guess they're probably participating in some sort of exploratory medicine that they've said, "Hey, what you're trying to solve for, I've got the element, so use me as a guinea pig." Or is it someone like you or I'm healthy, I want to stay healthy, I want to extend health span out, so I'm going to come spend a month, few weeks, whatever, exploring some of these new therapeutics. And is there also, are you recruiting people to come and call this home? What does that look like?
Yeah. So our target is not yet kind of the health maximizer, right? Simply because right now our target is the builder of some of these options, right? Simply because there's still not as much like there, right? There are some pretty cool options, and you can get gene therapies that you couldn't get elsewhere. And sure, through the membership, you get access to that, and it's cheaper and things like that, right? So that's part of the membership, but it's mostly focused on builders and entrepreneurs and scientists who want to spend some time with us here. Some of them are here temporarily, so they pay for like a daily or a monthly access pass. And some feel that they want to have like a long-term commitment to this, so they become annual members, which means they earn more rewards in our native token and things like that. And they typically do that, so they spend more time here. That means they get access to our co-working space, to like our event space. They can pitch to investors in our network, like Tim Draper and things like that.
So I got it. So this is basically the ultimate biotech makerspace. That's what we're dealing with here, right? I mean, so and for someone who again doesn't have the checkbook of a Pfizer or an AstraZeneca or something like that, but they've got, and it's crazy, Nick. I've got a guy I met at a luncheon yesterday. I'm going to introduce you to. It's PhD. He's had 8 exits, and randomly, I'm sitting there by him the whole time at this SMU luncheon, and we go to get up, and he said, "Hey," he said, "tell me about your holding company." I told him that we're all involved in health tech and what we're doing, and he said, "Well, I'm a biologist. I'm a biomolecular scientist, and I've created 8 different companies, and now I'm focusing more on longevity, and I need some help creating some of these therapeutics." And so I'm going to be getting with him recently to, probably within the next couple of weeks to follow up. And he's literally, I think, the perfect candidate, it sounds like, for what you guys are doing. Small independent player, wants to remain independent, but he needs the resources to go complete his research, prove it out, and then be able to commercialize it and bring it to market. So is that kind of the avatar deal?
Exactly. So we want to help people like him and other startup founders and entrepreneurs. Right now, it's an incredible bureaucratic
Yeah.
maze, right? That many companies are still able to navigate, but just think if the costs were like 10 times lower. And that is absolutely not out of the ordinary, right? So the costs have increased by more than 100 times in the last like 60 or 70 years. So there was a time where we got new drugs and treatments much more cheaply, right? We used to get 100 new drugs per billion in spend. Now we get less than one, right? So I think that's almost like a moral imperative to reduce that, right? So just like Elon Musk is saying, like, if we want to become a spacefaring species, we need to get the costs down to go to space, which means we need reusable rockets. Same with longevity. If we want to be able to like significantly extend human life, healthy lifespan, then we really need to make it cheaper and faster to bring more drugs and treatments to the market and to people and to clinics.
And, I hate to bring up, and I don't call it conspiracy or just, nefarious potential behavior, but the bottom line is, like, a lot of these massive, massive companies out there, especially from the pharmaceutical and biotech industry, they really, especially if they've already got something that's patented that they've monetized, and they're they know how much runway they've got to capitalize on, right? They're trying to get that return. They don't have the incentive to bring something, to spend all this money to bring something new to compete with what they might already have. And a lot of the things that all this investment has been made in has been for the treatment of sickness. And then so it sounds to me like this is more of a way for the independent out there. And like this guy that I'm telling you about that was with the big guys and was a professor, to kind of break away and go try to get some cutting edge technology that those large companies just don't have the incentive to bring to market anytime soon, because they've got too much in the pipeline that they've got to get sold, make money off, make their money back from all their R&D before they can bring it to market. So am I thinking about why this is such a one of the things solving for?
Yeah. So I would not put the blame on pharma companies, not even on the FDA or on politicians today, right? So I think the big mistake were the 1962 Hoover-Harris amendments to the FDA. I think this was just a bad piece of congressional legislation that caused many of the later problems down the road and the current market structure. And then afterwards, the market has just grown around adapting to this legislation, which means you now have special interests that don't want to change it anymore, right? So that's just the way how economics and public choice works, right? So I think the pharma companies within their constraints are doing overall good things, right? So we're still able to produce new and novel drugs and treatments at massive scale. Which is not the case anywhere else in the world. No, more recently, China is catching up, right? But Europe, it like has all these price controls in more countries, right? The United States doesn't have that, which means why the United States was always at the edge of innovation. Now that is changing, however, right? Because China, what they have actually done in like 2015 is deregulating, right? So an IND approval used to take more than 1,000 days. Now it takes less than 40
Wow.
days, right? So that's the reason why China is now catching up. So if the United States wants to retain its competitive edge in biotech, that's how I would think about this, right? So it's not like anyone's fault, pharma or politicians. It's like, how do we remain or keep our competitive edge? We still have some of the best scientists and universities in the world. We have the deepest capital markets for biotech, but we're losing it, right? So patients are going elsewhere, trials are going elsewhere. China is rapidly eating our lunch. What do we do about it?
Very cool. Very cool. And how much do you see AI playing a role in some of the work that's happening? Just from the scientists you've worked with that are in the biotech space, uh, I gotta think there's some really cool technologies. I know the stuff that we're building in our tech company, we're and I know it's nothing new. Everybody's looking for AI to solve some problem and how it can enhance. Are you seeing some pretty cool innovations come as a result of AI, and especially as it relates to speeding stuff up and getting things to scale quicker?
I mean, AI is just miraculous technology. It's just so many opportunities now to do research better, to go more quickly to the frontier. I am quite confident and bullish that AI can find sort of novel, synthetic, sort of ideas or connections that we haven't been finding before, simply because it's just able to process such a much wider amount of data than any human individually possibly could. So I do think we will have significant like drug discoveries that are aided by AI. Just something we might even be able to say that the AI was kind of the originator of some of the novelty of it. But I think it's also important to understand the constraints, right? So the AI is as good as the data you give it, right? And much of like the fundamentals of biology we just don't know yet, right? And we don't have the data yet to prove some of like the links that would allow us to actually have the right kind of understanding of the body, how the body works, right? So there's an enormous need for better and for good data, right? Without a DI, just won't solve any of these mysteries or problems, right? Because it's not embodied, it doesn't, right? So um, that is very important just to realize, right? So, and also AI can be used to expedite like drug approvals and things like that. And I'm glad that it is now, right? So, some people complaining about it, it still hallucinates or makes mistakes. But like, come on, people do that too, right? So, anyone who's using AI at the frontier is aware, okay, you need to be in the driver's seat, right? So you can't just accept things uncritically from the AI. At the same time, who can possibly deny that it saves you so much time?
Right.
Like that's inconceivable to me. So of course we should be using an AI for drug approval and things like that. But at the same time, what we also can't do is change the regulations itself, right? So we can only change the administration of the regulation, right? So I think it's also time to think about like how are we doing things in the first place? Who are we tasking with approval? And is this the right way of doing things?
So now here's and again, and just I know you're not a medical expert, nor am I, but you're living in this environment, in this ecosystem. You're helping create it and develop it. Is there anything you can speak to on like maladies that we currently have is just kind of accepted that like I've got a daughter who's got type 1 diabetes. There's a great example. Different forms of heart disease, cancers that you see today that based on some of the work
Mm.
that you've been around these incredible scientists, these incredible minds, the things that they're working on that you think in 5, 10, fill in the blank years won't even really be an issue that you truly think we can solve for with some of the technology that's being developed right now that you're seeing? Is there anything that comes to mind that fits into that?
Color
Really?
blindness, right? So color blindness, we basically, and I have this from one of the smartest people that I know, we basically know to how to fix it with gene therapy. And we know it's safe, right? The eye is a very isolated organism, right? So he would say he would do it right away. He knows the scientists who figured out how to do it. No
Wow.
brainer.
That's amazing, and that's exciting too. So my dad has macular degeneration, and I know there's been a lot of work on that for there's wet and dry mac, and a lot of it is just age induced. It set in whenever he was 39, which I think is the wet macular degeneration, if I have that correct. And so that's pretty exciting. And then with regard to now, I know that you mentioned Brian Johnson and who made his blueprint program famous. And one of the things about Brian, and this is kind of what I like to see that you're doing, is that Brian had to make 800 million bucks before he could go become the Brian Johnson we all know, right? He created Braintree, exited for, almost $1 billion, and then decided to try to not die. And a lot of people, kind of bust his balls for the crazy stuff he does. But you mentioned Elon Musk earlier. I'm like, I love the fact that Brian Johnson is willing to spend as much of his own personal fortune being a human guinea pig because we're going to learn from that. We're going to figure things out. He's going to go, like you said, he's been to out to your island, and he's learning things that we can all benefit from. And then, God willing, it goes to scale and it's able to get into the market. Um, so I love to see things that are happening along those lines. Are there any other things that you see happening that you're convinced we will maybe, I don't know, increase a standard, lifespan for a healthy, normal in a, I guess, in a, an industrialized nation by like 5, 10, 15%? I mean, where do you see this going? I like the whole idea of not of living forever. I'm not looking for, immortality, but I would like to know that I'm going to live healthily to 100 to 105. I wanna be if I'm gonna live to 100, I wanna be able to still play with my great grandkids. To me, that would be awesome. Do you see that becoming a reality based on the stuff you're looking at?
I want to be cautious here, right? So on the one hand, there's many reasons to be optimistic. On the other hand, we have not figured it out yet, right? There is nothing of, some of the stuff we know works and has some good effects, like the rapamycin, potentially metformin. But, there's also some legitimate criticism about some of these things. But we don't know yet a drug or a therapeutic that really reliably enhances your healthy lifespan, right? That's just a
Right.
fact, right? So we know it's possible. It wouldn't violate any laws of physics. There's different like therapeutic areas and different set of scientific approaches, like from the mitochondrial, cellular, reprogramming, and things like that. So there is all these approaches. I think the best, Peter Diamandis always makes a very good case for optimism and shows you some of the right approaches. And I really applaud that. At the same time, we need to be careful not to oversell what we have right now, right? So if I would point to, so that's why I wouldn't want to point at like something specific, except for one thing maybe, and I think that's the point that's a bit more missed from Brian Johnson, right? So we look at kind of the concrete things he does, like, is he doing his like ice bath or his like hyperbaric oxygen chamber and all of that. But I think more important than what he's concretely doing is that he's doing this measurement all the time, right? That's, I think, where the real revolution is, that we're living in the computer age. You have an enormously powerful supercomputer in your pocket. You could do all these measurements on yourself. There's a right number of solutions already out there. Why is that not more widely prevalent and widespread? The reason actually is that the FDA regulates what you can measure about yourself, like data about yourself and how to measure it. There were recently a couple of cases about that where I don't remember what the company was called, but it was like a very big case with a company that's providing some of these measurements, right, in your pocket, and you can access them, right? So the FDA is aiming to regulate that. That's where I think the really big unlock is also for us as a society, if we're able to give you as a patient your own data and the power in your hands to see what works and doesn't work on you.
I think that's huge, and that's one of the reasons why you see so many people wearing, continuous glucose monitors now that don't have diabetes. We're realizing that data is currency. And, I was just talking to one of the president of one of our companies, yesterday, and that's what he's so bullish on because he's doing a lot of population management for both insurance carriers as well as providers to try to be the bridge between those two. And it is all about data. And I get it. I know that and I told him as kind of just to really back up the point that you're making. I said, if we could get people that have never put a wearable on in their life to decide why not, and when you start to show them this behavior impacts this data set, and here's how you change that. What a mover that could be. I know it freaked a lot of people out when Bobby Kennedy said he wanted to see a wearable on every American because, oh my God, Big Brother's going to have all of our data and all this. It's like, I get that. I mean, I am, very much a libertarian in this regard. At the same time, if we the thing that doesn't get talked about enough, although I think it is, I think conversations like the one that you and I are having today are going to help that, is that when we're talking about healthcare, health insurance, all the problems, all the costs right now, the battle of the enhanced subsidies expiring, and a lot of people going uninsured. The thing that doesn't get talked enough about is how are we proactively keeping these people healthy? The single greatest thing we can do to keep a robust healthcare system and health insurance system, I think, is to have healthier people. I mean, that's it. And I agree with you that data plays a huge role. I'd love to introduce you to a guy, I think Justin Moore, I think's his name. He's the founder of Sprin. He's become a friend of mine, and that's the thing. And dude, he's got the thing I'm using now through my iPhone to do my body scans, do my body fat scan, is it's up there. It's not as it's not DEXA. It's not that, but that's what he does. He tests his scan against DEXA, and another business partner of mine, his clinic, who has a DEXA, he tests his data against actual DEXA scans, like on a weekly basis, almost to try to enhance the integrity of it. And so, to your point, it's gotten to now where we can watch our glucose levels. We can not only check out our body fat percentages, but also that subcutaneous fat to see that visceral fat around our organs that kills us and causes insulin resistance. We can look at all these things. And once you know where you are, then you can know where you need to go. And man, I'm hoping that some of those restrictions loosen up, and that's what I will go with you, brother, shoulder to shoulder to Capitol Hill and help these lawmakers understand, your Apple Watch is better. That is, you're probably using it just to get texts on it, which is distracting and probably, diluting your cognitive bandwidth. You could be using that for a lot. Americans could use that for a lot better reasons than that. So I'm with you on that.
Yeah, what you're doing, Jason, insurance is the
Yeah.
frontier, right? So insurance is the way to set the incentives, right? The ultimate institution, or the idea to really fix the healthcare system as is comes from someone I admire a lot named Robin Hanson, who said, "What if we combine life insurance with your healthcare provider?"
Yeah.
Right? Because this way, that institution has an incentive to keep you alive longer, right? So this is, I think, ultimately where we need to go to it, thinking about how to create incentives like that to make people healthy.
100%. And you just nailed something there that whenever I go to Capitol Hill and I'm talking to lawmakers, a lot of them, when you say value-based care, they love it. That sounds great. I'm all in, but they can't define it. And you just defined what it means. It's the outcomes that drive the incentive. And also I say the same thing whenever whether it's on behalf of our foundation or our nonprofit, whenever explain kind of our big money maker, which is health insurance and health insurance technology. I'm like, if you guys can stop making health insurance this like panacea that it's the cure all, but instead treat it as a gateway to the health journey to get people in to start getting the data they need, to start getting them the education they need, to start driving the incentives for their health. That context change will make such an impact, and that's what we're trying to do. We're trying to say, "Look," and that's what we're doing with these health access centers. We're bringing people in to help people, if they're uninsured, get on a plan that works for them, but then teach them how to use the plan, how to guide them through that process, and then once you do that, it's literally it's just a magnet. It's just a gateway into their health journey, and once you get them there, then you can start making finding the real drivers for their health, and so it's like going back to Peter Diamandis. A lot of what we're talking about, brother, and this is what I love about what you're doing. It's moonshots, but if we don't take them, nobody else will.
Exactly. Like that ultimately, I think one lesson or one learning I have from as an entrepreneur is just like we can just do things, right? So we don't have to be limited by, I don't have, we have our imagination limited, right? So there is much more that you can do in the world than you probably think, right? So this is what I learned from being in Prospera. And also now with like the legislative changes, right? So learning to work with US states, right? So things at the state level are much more feasible than elsewhere, right? So, no excuse to complain. There's lots that we can and must do.
100%. Before I let you go, I mentioned this before we got on, and I'm just going to go ahead and kind of tee it up. Based on the conversation we've had And, what are the three main takeaways that you would like for people to have about your company, your mission, and just overall health and wellness in as it relates to, and obviously my main focus is America. That's the soup I swim in as far as healthcare and everything. But just globally, what are three main takeaways from this conversation you'd like this audience to have?
Yeah, so one is to look at special economic zones and startup cities in novel jurisdictions like prosper and visit us here, right? Because, the American dream is very much living on here. And I think some of the innovations here can positively invigorate the American spirit as well, right? So visit us, maybe during September, during the Biofrontiers month, so which you can find on our website at Infinita City. But we have more programming throughout the year. Second, like we are looking especially to connect with people healthcare practitioners, people who've done clinical trials before, worked in manufacturing, people like you, Jason, or your network with insurance, and to really build a robust program in Montana, right? So you can look up the SB 535 right to try legislation, which I think really can set the country on a different trajectory because it's the only right to try in the country that is compatible with the longevity paradigm, right? So what I mentioned before, that longevity is breaking the paradigm, right? Because it's not a clinical endpoint. In Montana, we can change that, right? And then I think third is really continue having a conversation, like whether you call it make America healthy again, but the right questions right now are raised. Like how are we funding science? How are we collecting data? Like what's kind of the paradigm by which how can we change kind of the paradigm really in fundamental ways to make it possible for people to take health back into their own hands, which I think is ultimately what gets us to be healthier.
I love it, man. Yes, exercise the agency that we all have. That is the key. And one of the things we didn't talk about that I'd be remiss if I didn't mention. You talked about when I asked you about some things for longevity that are being developed. The one thing that cannot be prescribed that seems to still outpace all of them is exercise. You got to get out there. You got to take it. Just do the free stuff. Nick and his team and all the scientists that are going to come out there are going to come up with some really cool stuff. But if you're not gonna be out there right away, and you're not gonna be it's not gonna come in a pill that's gonna make you live longer and healthier. Get out there and exercise and train, and and then Nick's gonna create an ecosystem that allows for some amazing therapeutics in the future that I can't wait to see what comes from it. So, bro, Nick, this was so fun. I look forward to many more conversations. I look forward to working with you on some of the outcomes that we're both passionate about. And thank you for sharing the vision and what you're doing with this audience.
Just a lot of fun. Thanks for having me on, Jason, and thanks everyone
All
for
right, brother.
listening.
I'll talk to you soon. Well, that does it for this episode of The Jason Wright Show. Thank you so much for listening. This has been a Texas Titan Media production. Fourth Wall did the music. And as always, thank you so much for listening. Please consider going out to jasonwrightnow.com and signing up for the Vitruvian letter. Also, please go out to iTunes. It takes like 30 seconds to just leave us a 5-star rating. It does wonders for the podcast. I would be so grateful. And with that, until we meet again, go crush it and endeavor to improve always in all ways. I'm out.